You may have heard about the increasing popularity of oral sunscreens, or edible sunscreens is what they're commonly called. And these are products that are over the counter, not necessarily FDA approved, but can be used as an adjunct to your normal traditional sunscreens. If you remember, traditional sunscreens help protect from UV damage by helping minimize the absorption of UV rays into the skin. These edible sunscreens are typically over-the-counter products that are antioxidants or plant extracts that can help protect at the cellular level. Two most common forms of oral sunscreens are polypodium leucotomos extract, or PLE, which is a little easier to say, and nicotinamide. And both of these products have been shown to help protect to a certain extent from the damages from UV rays, but it's not the only product that you can use. So in essence, what you want to remind your patients is that these products are to be used as an adjunct or as an additive to your traditional sunscreens. Some of the ways in which polypodium leucotomos actually helps protect from UV damage includes antioxidant properties, helps decrease free radicals and reactive oxygen species, and thus reducing the oxidative stress that DNA damage can do to your skin cells. It can also help as an anti-inflammatory, help decrease Th1 cytokines, for example, and may actually help preserve Langerhans cells and reduce the UVB-induced immunosuppression. It also can increase the MED, or the minimal erythema dose, which helps reduce the impact of UV exposure. And in fact, these products actually can help protect to a certain extent, but are not the main protectors of skin. So when it comes to these products, you want to make sure that you're using them in conjunction with your typical sunscreen products. So you want to make sure that you're using a traditional, either chemical sunscreen or mineral sunscreen, which includes zinc oxide or titanium dioxide. And the important point is to remind your patients to apply before you go outside and before you're exposed, but use your sunscreen on a daily basis. You want to make sure you reapply every 2 to 3 hours. You want to make sure that your products are water resistant and that you're reapplying, particularly in high sun exposure times, or if you're going to be outside for extended periods of time, as well as if you're perspiring, swimming, those types of activities. When it comes to water resistance, you want to make sure that you're reapplying to prevent the capacity to burn if you find that the product is no longer water resistant. You also want to make sure that you're applying enough of sunscreen. It's very easy to skip places, forget places like behind the ears, on the scalp, hands and feet. You want to make sure that you're using other sun protective measures and encouraging your patients to use things like high quality sunglasses, protective sunwear, UVB protection when it comes to protective clothing, wearing hats, and remaining in the shade if possible. When it comes to dosing polypodium leucotomos extract, typically you want to take between 240 milligrams twice a day. At times when you know you're going to be exposed to the sun, you want to go ahead and try to take it a few hours before exposure. In addition, another product that's particularly helpful when it comes to edible sunscreens include nicotinamide. Nicotinamide can help in terms of protecting against UV-induced immunosuppression. So it has been shown to help decrease the number of actinic keratoses, as well as possibly decrease non-melanoma skin cancers. Nicotinamide is dosed as 500 milligrams twice a day. And the idea is that you're going to be taking these consistently on a daily basis to help protect overall. Sunscreen as well is most helpful when you're using it on a daily basis. So it's important to encourage your patients to be using them consistently on a daily basis, whether it's sunny or cloudy, regardless of the weather or temperature outside. Daily sunscreen can decrease the incidence of skin cancer, in particular melanoma and non-melanoma skin cancer, such as squamous cell carcinoma. So it is important to be used on a daily basis. When using polypodium leucotomos extract or nicotinamide as adjuncts to your sunscreen and skincare regimen, you want to make sure that you're using them on a consistent basis as well. It's also important that while these are very safe to use, typically no drug interactions, these are not a replacement for your typical sunscreen. You want to encourage patients to use these in conjunction to their typical chemical or mineral sunscreens.